I'm Dr. Tanagrath Pia Conan. I'm from Bangkok, Thailand. I'm very happy and excited to be here to be sharing my experience in hand rejuvenation with Gouri. As you can see that Gouri gives a very good result on the face and on the neck, as my dear colleagues have shown you. But what if we forget to treat other part of the body? If you just focus on the face and the neck, your patient might end up looking like this or this. So there is other part of the body that shows a true telltale sign, and without a proper management, hands can really reveal your true age. So hands aging, the thin skin of the dorsal hand is usually very thin, and there are like a lot of changes when the hands is aging. Started from thinning of skin gets to get wrinkled, and then it shows the vein and the extensor tendon. But the hand aging itself, there are many factors that affecting the hands aging, including the intrinsic factors such as genetic, metabolic disease, or some hormonal change, and also some disease that affect soft tissue or bone, and also the extrinsic factors such as activities, wound, or thermal and chemical burns, and also UV radiation. So natural aging process of the hands, as I said, it starts from atrophy of the soft tissue and muscle, and then you start to see the wrinkle, and then you start to see the dorsal veins and extensor tendons. So what do we see when the hand is aging? We see the wrinkly skin, we see the loose skin, roughness, pigmentation, skeletonized hand, which comes from loss of fat fullness, and visible vein and prominent tendons. So we have had a lot of treatments available, including topical skincare, laser, chemical peeling, filler or fat graft, and also sclerotherapy. But there is also some limitation from each treatment that we have had. So with the hand grading scale, actually it is a tool for us to assess how bad or how severe the aging hand is, and also to communicate with our patient to tell them that, to show them how good the result is after the treatment. The hand grading scale usually is based on the loss of fat volume, and then the visibility of veins and tendons, wrinkles, and also pigmentation density and darkness. There are actually a few systems, but there is one that is pretty common, that is from MERS. They actually started from grade 0, when there is no fat loss at all, and then from the grade 1, when you have mild loss of fat tissue, and grade 2 and 3 and 4 and so on. And with grade 1, you started to see the change of the visibility of vein, and from grade 2, you started to see both the vein and the extensor tendon, and so on to grade 3 and 4. So I would say that mostly with the hand grading scale, it is based on the photograph. And as I said, that some other system, they also focus on wrinkle and also pigmentation density and darkness. So I would say that the best to grade the aging hand is by photograph. And so we come to the anatomy of the hands. You can see that the skin on the dorsal part is a lot thinner than the palmar part. And then with the hands on the dorsal side, there are the fat distribution that is divided into 3 different lamina, which is a superficial and intermediate, and then the deep lamina, which is separated by the fascia, superficial, intermediate, and deep as well. So you see that on the top layer, on the superficial fat lamina, there is no any important structure. There's no vein, there's no nerve. But when it comes down to the middle or intermediate lamina, there is the vein, and in the deep lamina, there is the extensor tendon. So as I said, that all this fat distribution is separated by fascia, and then we see that on the superficial lamina is the safest plane for us to treat the aging hand with Gouri. You see that the superficial part is the safest one, and because there is no important structure. So again, Gouri itself is a fully solubilized polycaprolactone. It comes pre-filled, ready to use, and it doesn't have any microparticle, so it can reduce all the serious adverse events that we are afraid of, such as granuloma or vascular occlusion. The PCR itself stimulates collagen production by inflammatory response and wound healing pathway. So the injection technique that I'm using with the hand is very easy. I use the plane that I use is the subdermal plane, which is a superficial lamina, and the cannula that I use is a size 25G, 50 millimeters. You can, as Dr. Manos has shown, you can choose to have topical numbing cream, or you can pre-fill where you want to inject Gouri with the lidocaine. Because from my experience, I have tried on myself. The Gouri itself gives you some, I would say, burning, tingling sensation without any lidocaine. So it's going to make your patients feel a lot more comfortable if they get some of the anesthetic to help them to feel better. And I do not recommend you to mix Gouri in the syringe with other products. And this is the video to demonstrate. So I use two different techniques, two different approaches. The first one is from the proximal end of the dorsum hand. I would divide it into 4 tracks, 2 each interdigital space. And then I would inject lidocaine with adrenaline at the entry point. We'll inject or precannulate with the tracks that I already marked with lidocaine without adrenaline. Exactly the same amount as I'm going to inject Gouri. So I use 1 ml of Gouri for each hand. So it's 0.25 ml per track. So I'm injecting 0.25 ml of lidocaine per track as well. To inject the lidocaine helps the patient to feel a lot more comfortable, and also it is to give like a hydrodissection result, and so that when you inject Gouri, it will be a lot easier. You see that I go very superficial, just do small like pinching technique, and the injection itself is very easy. And because the product can spread easily, immediately after, you don't need to massage or you don't need to mold anything, and it looks very normal. So that is the first technique. And the second approach is from the distal end of the dorsum of hand. I use 2 different entry points, and then I draw 4 lines of the Gouri injection. The same, I would pre-inject at the entry site with lidocaine with adrenaline, and then I would inject lidocaine without adrenaline on each track, the same amount. So I divide it into 4 tracks, then I use 0.25 of the lidocaine on each track. You see that the technique is very easy because in the subdermal plane or in the superficial lamina of the fat of the dorsum of hand, there is no important structure. So with 1 ml of Gouri on each hand, it is divided into 0.25 per track. So it is very, very easy. If you have done filler injection or fat graft in this area, you know that it's a lot difficult in this. So that's why I love treating dorsum of hand with Gouri now. Okay. And immediately after, it looks very normal. And then I want to show you some of the cases that I have. So with the first case, it's a Thai female, 38 years old. You see that actually this hand is probably like grade 1. It's just there is some very minimal fat loss. There's no tendon shows, there's no vein showing. So I did 1 session of Gouri with 1 ml of Gouri, and this is 4 weeks after the treatment. You see that now it looks pretty much like Gouri gives some volumizing effect, but it is because the skin gets tighter, so it gives you the appearance of the filling agent, like as if you had fillers done. So with the second case, 49-year-old. She also gets one session of Gouri as well. You see that the appearance of the tendon is less. Some of the pigmentation is improved, and you see that there is some volumizing effect as well with this case. When it is the very low grade of hand aging, when you get the Gouri done, you can see that there is similar to the volumizing effect. It gives the hands rejuvenant effect like that. So this is also the 4th week as well. And then this is the third and the 4th case are actually my own parents. I just want to see how the Gouri would work on like a really aging patient. So this is the case number 3 is the male, 80 years old. He also got one session of Gouri with 1 ml as well. This is the result after 4th week. You see that there is still some visibility of vein and tendons, but the skin texture and the wrinkle has improved so much. And when you zoom in, you see that the line and the skin texture has improved because the patient is very old. So I would say that with just one single session, it gives the effect like this, the patient will be happy. And then this is a follow-up photo in real life. It is actually after 12 weeks. You see that on the right hand it is a treated side and the left hand is the untreated one. The discoloration, the pigmentation, and then the disappearance of the vein and tendons, and also with the wrinkly skin, it has improved so much. And case number 4 is female, 81 years old. She also gets only one session of Gouri. This is the result after 4th week. You see that the skin texture has improved, and also some of the discoloration has improved as well. When you zoom in, you see that the skin texture has markedly improved in just one session. And this is in a real life photo at 12 weeks. You see that the treated side and the untreated side are a lot different. And then this is the case number 5 with females with 42 years old. But with this one, she gets 3 sessions of Gouri, 1 ml per side each time with a 4-week interval. This is the before photo, and this is the 4th week after the first session. And I have, with this case, I have more time to follow up with her. So with this case, the last photos is actually at 36 weeks after the first injection. So it is, so with this case, I did 3 sessions every 4 weeks. So it is 24 weeks after the last injection, but it is 36 weeks after the first session. So you see that the skin has improved, the skin quality has changed, the appearance of the tendon and the vein has markedly improved as well. And also with this one, case number 6, she's a female, 45 years old. She also received 3 sessions of Gouri, and this is after the first session. You already see that after the first session, the Gouri has improved the skin quality and appearance of vein and tendons. And also with this case, I follow up at the 36th week after the first injection. You see that the result of the Gouri is still there. So I would say that the Gouri would actually, as Dr. Manoj said, that it is sustainable. The result of the Gouri itself is quite long. So I would say that Gouri itself is injector friendly because it comes pre-filled in a syringe, ready to use. You don't need to mix it with anything. Just put in the cannula and then just give it a go. The technique itself is very easy, and it gives a long-lasting result from 6 to 12 months. Okay. That would be all for my presentation. Thank you.